GHIR with assisted humeral head posterior translation. This glenohumeral joint internal rotation stretch is an adaptation for clients with slap tears. So this is something that can be applied to the glenohumeral joint internal rotation 80-20 stretch. Now, just like the other series that we've produced education on for external rotation with this assistance, it's also the same things going to be applied here. And that is that extreme caution must be applied with this, because if you're not very adept at this, you're not practiced, you're not experienced with this technique, you should absolutely not do it. So the first thing I'm going to advise you to do is everything you learn here, I want you to practice it a lot with your colleagues, with your fellow trainers or therapists prior to actually doing this methodology on a client or on a patient. So, first, reason for this adaptation to the glenohumeral joint internal rotation stretch is that the client has a slap tear. So when a client has a slap tear or a superior labrum anterior posterior tear, not only are they subjected to shoulder impingement, but they're also subjected to the actual humeral head translating anteriorly and sliding within the glenoid fossa of the shoulder joint and causing additional friction, damage, shear stress, and pain for the client. So one of the ways to remove that as we go into a glenohumeral joint internal rotation stretch, which of course is going to be for the purpose of stretching the infraspinatus and teres minor. So those are the tissues that are going to be stretched in this. So what we're going to do is we're going to loop the band over the anterior portion of the client's humeral head, and then we're going to loop our foot through the band. Now this could also be done where you're standing more off to the side and you have an assistant trainer pulling the band downward instead of your foot doing the pressure. Again, this is something that I've done for many, many, many years, so I have a lot of experience doing. Until you gain a lot of experience, don't apply this to a patient or a client. So what we're going to do is we're going to pull this band down, which is going to keep that humeral head from anteriorly translating with the client with a slap tear, and then we're going to begin to rotate that arm into an internal rotation position. And if you're finding, depending on the client's internal rotation range of motion, you may want to come back to a superior side position so that's not in the way of the client's arm actually rotating. So you could pull down from here and then apply this stretch here. And then what you want to do is, getting into this stretch, you want to first ask the client, how does this feel? How does the band pressure?
The band's fine.
Okay, so the band, you want to make sure it's fine first. The client's good with that. You're feeling the stretch, you're feeling comfortable. Good, so that's your first check. Then your second check is actually going into the stretch position and asking the client, if you would please tell me on a 1 to 10 scale as we increase the stretch.
5, 6.
Okay, so 5 and then 6. So the maximum that you're going to want to go in this stretch is a 6, and we got there to a 6. Do not go past a 6, although 4 and 5 can also be very beneficial, but absolutely don't go past the 6.